therapies are very important. But when we are talking about disability and rehabilitation is a combined and coordinated effort. It's just not one aspect. Okay. So here you have to be very open for the referral services when they were possible. Uh, don't treat any person as if it is a medical case. Consider disability as a social case. It's a social issue, not a medical issue. What do we expect? What do we expect from rehabilitation of person with disability? What we expect is they should be able to participate in their social life. They should be able to participate, not only go to school, go to have job opportunities, enjoy social life, get married, and other things. So like any non-disabled. So for that to happen, you must focus on the activities of daily living. You must focus what are the activities you can do, plan in that way. You can make your short-term goals, long-term goals. You can make their activities plans so that the activity of daily living become easy. And this is where it can only come when you don't think that person with a disability as a medical issue, but more of a social issue. Further to that, uh, I also request one thing that whenever you focus on children coming to therapies and other thing, please do realize it's very difficult for many people to come on regular basis, especially if they are coming from a remote areas, if you're coming from far distance places. Therapies are very important, especially the physiotherapy I have seen in for people with disabilities, for whether it's whether it's early intervention or with for elderly, stroke, Parkinson, everybody. Okay. However, there is a need for community-based rehabilitation. Uh, these days, the new term that is we call as community-based inclusive development, CPID, which we have graduated from community-based rehabilitation to community-based inclusive development, which talks about inclusive development, inclusion from all aspects, just not about the therapeutics, but other aspects also. So one of the things that you should do is, as part of the community-based rehabilitation or CBRD, is to sensitize the people who are in their surrounding. Of course, first should be caregivers, neighbors, other extended family members, teachers, uh, community members. If you they stay in a village members, panchayat. So there is a need to sensitize them. Okay, there is a mentioning them there is a child with disability who requires certain intervention. Okay, who may or may not be come, but these are the ways you can help them. So in community-based rehabilitation, what we focus is on the transfer of your skills from a very high skill person to the other skill person so that they can able to continue their support. Similarly, you ensure that they have access to all the other facilities, all the government facilities, certification, disability certification, pension, access to education, and this thing, so that the person who is a person with disability participate in their have full participation in the society. Uh, Also, community-based rehabilitation. There is one very important aspect why community-based rehabilitation is needed because number of rehabilitation professional, number of physiotherapists are very less. While the incidences of disabilities or even other conditions like back pain, musculoskeletal pain, other things is very high. Number of people, but number of professionals are very less. So in order to help them, we require a community-based aspect where you can transfer your skills, tell them how do you do the home-based therapy programs, okay, and you monitor it. CPR doesn't say just to transfer it, but it also says you have to monitor it. For example, a child who requires a 5-day session and he stays in somebody a very remote place, which is 3 hours journey from Pune. They cannot come on day-to-day basis, or if they decided to shift it for some time to Pune, it will be very expensive for the parents. The other way forward is you teach the community members, train family members on this aspect, and they come instead of 5 days a week, they comes once a week or fortnight, so that they learn it, you supervise them, and then they continue to practice this. Please do realize for people with disabilities, so for some people with disabilities, especially in the early childhood, the rehabilitation takes very long time. Okay. So And this is why it should not be dependent on very skilled professional, but it should be dependent on the semi-skilled professionals like parents. One final thing before I finish this thing, please ensure that mental and social well-being of yours as well as of the clients or client, we generally say clients or and here sometimes we use patients of people with disabilities is at the optimal level. You may be witnessing a lot of day-to-day cases having people with disabilities. You may feel burnout, you may feel stress. So here you need to understand, you need to take a break uh, because unless and until you don't take care of yourself, because self-care is not selfishness, self-care is very important to ensure that you continue to provide services. Also, mental and social well-being of the parents of children with disabilities. Do suggest, tell them about the relaxation exercises, tell them about, ask, refer to them where there is a parent support groups, refer to them for the counseling wherever possible. Or sometimes you can also speak to them, hear them out what they want. Right? So these are the things where you can sure you be inclusive for everybody. So for my call for action is for physiotherapists is that just go beyond treatment, uh, be an educator, be an innovator, be something an influencer for their life. Okay. Uh, Wherever possible, you update yourself about the disability training. Like for example, what terminologies to be used, what are the accessibility issues for people with disabilities, what you can do for people with disabilities. What are the reference services? So you should train yourself on this thing. Uh, Include physiotherapy in early caregiver plan, but just not for the people with disabilities, but for their family members. Apart from that, I also would say is that be empathetic, be listen, be patient for them. And wherever possible, if you are a physiotherapist, if you have your own clinic, if you have your own rehabilitation center, please ensure you invest in your increase infrastructure. If you are a college, please ensure that you train and your physiotherapy students on the understanding of inclusion, the referral services, how multidisciplinary approach helps. And wherever possible, please do understand that physiotherapy is just not about physiotherapy is just not about giving therapy. It is about bringing changes in the life of many people. So with this, I end my session. I'm really grateful for the Sancheti College of Physiotherapy for providing me this opportunity. I do hope that budding physiotherapists will get a different dimension of various understanding on disabilities. Uh, my sincere thanks to Radha ma'am and other colleagues, Fareen ma'am, Dr. Fareen ma'am, and sorry, I forgot your name.
Prathamesh, sir.
Prathamesh. Yeah, Prathamesh. Prathamesh has been a very good moderator. Thanks, Prathamesh, for being very patient with me. Thank you so much.
Yes, sir. Thank you so much, sir. Indeed, it was a very knowledgeable session. But I have one question for you, sir.
Yeah.
Sir, when we are working in a rural setup, there comes the patient, person with disability or children with disabilities. So, what do you think is the most challenging part while educating the patient or the family, and how you tackle such situations?
Yeah, thanks, Prathamesh. It's a very nice question. Okay, when people come to you to watch persons with disabilities, okay, or sometimes the parents comes to who have children having disabilities. First thing is you have to acknowledge the fact that they have approached you. They are hoping something from you. Okay, and they might believe there is something from physiotherapy physiotherapy can help us. So once we acknowledge the fact, it becomes very easier. Okay. Uh, One of the most important things for us is educating our stakeholders. Okay. What this condition is. Okay. And how do you ensure can you live with this condition, but you can fully participate in your day-to-day activities. Okay. So this is how where you should start with, right? They may ask how long will that general question will generally the parents do ask, will my child be back to like anybody child? You have to tell them very honestly. Okay, he's a child with cerebral palsy. Okay, during his childbirth, during his early developmental stages, the brain has absorbed certain pieces. So, no doubt about it. He may be little slow compared to other child, okay? But he is your child. He or she is your child. He is still special for you, and he is or she is still special for us also. Okay, it doesn't mean his condition make us to ignore him or neglect him. Okay, so tell them very honestly. Okay, we will definitely try to whatever possible so that he or she can able to go to a school, can sit in the school, can able to walk till school with assistive devices. Okay. But but irrespective, he must be provided with that opportunity. Okay. That can only come if you believe in this. Okay. And tell them we are there to help. We are there to help from his perspective. We'll make a plan, which are his challenges and how we can overcome. Also tell them not everything is under our, if few things are beyond our scope also. For example, speech. Okay. For example, his intelligence. Okay. But wherever possible, we will refer to a right person. If he is a child, he's a if a child with cerebral palsy and have difficulty in speaking, we'll refer to a speech therapist who knows we know close by. Okay, who also can provide services, similar services. Okay, so that he should be able to speak. We'll refer to a special educator where he can be school ready to do this. Will help you to that school should be able to admit this child. So you have to give them, you have to offer them what are the choices, the different choices for them. Same way with adults also. If he's a person with Parkinson and other things, so tell them yes, we feel we empathize with you, the challenge that you are facing. But we will focus that your activities of daily life. You should be able to do your you should be able to go for washroom independently, toilet activity, your food, your home, your bathing, at least with difficulty, but independently, wherever possible. So these are the things, and tell them you have to be patient.
Yes. Thank you so much, sir. Yes, I would like to thank our chairperson, Miss Manisha Sangvi ma'am, Dr. Parag Sancheti sir, and our respected principal, Dr. Apurva Shimpi sir, to giving me this opportunity. And last but not the least, our technical team. Thank you so much, sir.
Thank you, Pratamish. Thank you so much.